Hello, and welcome to this edition of Oncology Data Advisors coverage of the Oncology Nursing Society ONS Congress 2025. In honor of Oncology Nursing Month this May, we sat down with Gretchen McNally, a certified nurse practitioner specialist at the Ohio State University Comprehensive Cancer Center, about their presentation on tackling the stigma of cancer. Today we are joined by Dr. McNally, who presented recently at the ONS Congress 2025. Would you like to begin with introducing yourself and what you do, Dr. McNally?
Yeah, thank you so much. I'm so excited about this opportunity. My name is Gretchen McNally. I am a nurse practitioner scientist at Ohio State University James Cancer Hospital. I have worked in hematology, specifically lymphoma, for over 18 years now as a nurse practitioner. I work primarily in an immunodeficiency cancer clinic, so people with HIV, solid organ transplants, autoimmune diseases. And probably maybe 2013-ish, I became really interested in substance use disorders in people with cancer. And that took me down a road where I really learned a lot about addiction-related stigma. In 2022, I decided to go back to school for my public health degree, master's in public health. And there I was really able to specialize in stigma and became an expert in intersectional cancer-related stigma. So I went from HIV-related stigma, addiction-related stigma into this whole new world. And that's kind of how I got involved in this topic.
Terrific. Well, we're definitely excited to have you today to hear more about your expertise and what you presented. So, to begin, can you provide a brief overview about your presentation regarding the stigma of cancer?
Yes. So I was really fortunate to work with some great colleagues on this presentation. So Lisa got us started by a real life case study, which was her background is in lung cancer and stigma. Um, and so this patient presented to the emergency department with symptoms of cough, shortness of breath, and on further workup, imaging, I think it was a chest X-ray, demonstrated mass in their chest. And so at the nurse's station, the physician and nurse were talking about this image, and the patient came up on the nurse's station and overheard them talking. She didn't realize she had what turned out to be lung cancer, and they were talking really negatively about her, assuming she was a cigarette smoker, and so that kind of set the stage for the discussion. And then I went into talking more about stigma, how it's multi-level, multiple kinds of stigma, like internalized or self-stigma, public or perceived stigma. And I kind of went through more of that framework. And then Carrie talked about specifically stigma associated with palliative care, with opioids, and then with hospice. And we finished by talking about language and communication and strategies that we as nurses can start implementing today to reduce or mitigate the negative effects of stigma.
What's an example of some stigmas a patient might experience through their treatment journey?
Yeah, so that's a great question. So why stigma matters is, I mean, it doesn't feel good to be stigmatized. It's really a social phenomenon, and it's recognized as a barrier to care. So stigma can keep someone, like all across the cancer continuum, for example, stigma, embarrassment, fear can keep people from receiving like preventative testing or other things. Then when they find out that they have cancer, stigma might impact them presenting for care, receiving the recommended treatment. So stigma can be like a person, they can have intersectional stigma, say race, gender, age, disease, or health-related stigma, all different kinds of stigmas. And then clinicians can also have stigma, and their stigma may keep them from offering like the high quality care to the patient. So it impacts prevention, diagnosis, treatment, and then even into survivorship. People may be less engaged, or even like job-related stigma, work-related stigma. They may be, fired, or they may not be promoted because of cancer-related stigma or intersectional stigmas. It's important to realize that what I mean by intersectional stigmas is like it's where two things are more than individual stigmas.
Mm. Speaking of clinicians, how can clinicians better educate themselves to be more informed about these stigmas that patients may be experiencing, or even their own unconscious bias that might create a stigma?
Yeah, so that's a great question. So of course, being aware of that you may have that bias or stigma against something, education is, one of the best things to help decrease stigma. And then I like to say, and we kind of concluded our presentation um, with language. Like language impacts the way you think, feel, and act. And the words you use are really important, and they can influence the care that you provide. Research has shown, now my background and my knowledge is mostly related to addiction, where they have shown based on the terminology used to describe people that even highly trained clinicians may based on the language used, may have different thoughts about people, and may be more blaming, or which would be failing to recognize the medical nature of a disease, for example, or may not offer the high level care or recommended treatment because of that.
What role do you believe clinicians play in diminishing and mitigating the spread of stigma in cancer?
So I think that it's really important that when we talk about cancer, so cancer is highly stigmatized, and certainly some cancers more than others. Cancers that are associated with a perceived behavior, such as lung cancer, for example, which is really associated with smoking cigarettes, when people are found that they are to blame for their cancer, that makes it more stigmatized. But cancer in general, when you how it's portrayed in the media, for example, is often, no hair, alopecia. People are often kind of very sick, weak. They often are dying. You don't see as often all of the success stories. And so all those things lead to stigma. I think of on a personal level, my mom passed away in January from what came to be, we found out, was a lung cancer diagnosis. But going into January, she was experiencing a lot of fatigue, weight loss. She had a terrible cough, and she knew that this was going on, and she was really afraid of stigma. She had seen, family members get cancer, and need to a lot of care, not able to be active, and she didn't really see as many success stories, and that was a barrier to her presenting for care and for getting diagnosed. Just as one example.
I'm really sorry to hear about your mom passing away, and wanted to pass my condolences to you and your family.
Oh, thank you so much. Thank you. Yes. It's ironic because all she really is like reinforcing all my work in stigma, because she is the perfect example of someone that was experiencing intersectional stigmas and how it was a barrier to her presenting for care, receiving care, and so she's kind of now the driving motivation behind everything I do for that's stigma related.
That's terrific. I'm glad that there's that silver lining for you. So that's beautiful.
kind of off topic, but I presented at NCCN 2 weeks before ONS on intersectional stigma and reducing intersectional stigma. And I used my mom as a case study throughout the presentation as an example of how all these different levels and stigmas were affected her care.
How do you think, or like, did you, while going through this study and presentation of stigma, did you notice how media portrayal of cancer influences public perception in stigma?
So that's a great question, and it's really funny. For this presentation, I found a article by David Benjamin and colleagues. It was published in January of 2024, looking at media's portrayal of cancer. It looked at movies between 2010 and 2020. And the article starts off with a quote from actress Audrey Hepburn, which says, "Everything I learned from the movies." And that is so true. And I always say, if I see a movie on whatever topic, I am now an expert on that topic, which probably is not, it's definitely not true. And so people see characters in movies portrayed with cancers, and they start to think of that as being, that's really what it's like to have cancer, or all cancer is the same, not really recognizing that there's so many differences. And as I think I mentioned earlier, people often in the movies have cancer, they don't have any hair, they're undergoing chemotherapy perhaps, and then they usually, nothing can be done and they die. And so that's not really true at all. And so I think that there needs to be more positive stories of cancer in the media.
Is there anything else from your presentation or stigma in general that you would like to talk about before we end this interview that you think is important for our audience and people to know in general?
Yes, I'm so glad you asked that question. So I actually had this aha moment as I was preparing for ONS Congress. But like we often hear that like so and so, like even my mom, for example, you hear, oh, my mom died of cancer, lung cancer. And then there's often this but statement. My mom died from lung cancer, but she smoked cigarettes, right? So she knew that was a risk factor for cancer. And that but statement makes it seem like that's okay. Like, yes, she smoked cigarettes. So it's okay that she got lung cancer, right? She knew better. And I really don't like that attitude or that blaming. We should never, when someone gets cancer, there should be no but statement. But they, drank, or but they were overweight, or but they didn't take care of themselves. People should just be, cared for compassionately. There should be no blame. And so I really think that we need to get rid of that but, because that almost seems like cancer is their punishment, or like they deserved it, which certainly is not true.
Definitely thank you to you and your team for doing this research and this presentation to raise more awareness to for us to tackle these stigmas and hopefully get rid of them, because no, like you're saying, nobody deserves to go through such like a life altering diagnosis and treatment to hear those kind of but statements. And before we end, I did want to ask, since this will be my final question, since May is Oncology Nursing Month, are there any messages you'd like to share regarding the importance of oncology nursing and how nurses in particular can help tackle the issue of stigma?
Yeah, so I think that nurses are like the number one trusted profession. They've been that, other than I think 2001 when firemen were some, or maybe police officers because of 9/11. But nurses really, they're the ones that are at the bedside. They're the ones caring for people. They're the ones that, patients are comfortable asking questions to, about side effects that they're having. And so nursing is really an art. It takes the medicine, like the skill required to treat something, and then it delivers the skill compassionately. It's really all about relationships. And I don't think like AI will ever replace nurses, because they just do so much for people that are ill and need care, or help prevent them from getting ill. And I think that right now, so I think May is a great time to celebrate that nurses. But I also think it's important to recognize that nursing research is so important, and nurse scientists in focusing on those areas that aren't medicine based or cure based for like cancer, for example. And the way I kind of like to think of it is like, what does it matter if we have all these great medicines and treatments for cancer, but then people aren't getting to that, to get those treatments because of things like stigma? Does it really matter? The people that need it the most are not going to be able to access that care. So I don't, that kind of ends that tirade.
All good. Yeah, thank you so much for, again, your research and your passion on this topic, Dr. McNally. We really appreciate it and you taking the time to talk to us today.
Yeah, I really appreciate the invitation and the opportunity, and I hope that all your questions were answered and it all makes sense.